河北医科大学的MANAFE HENDRA， 它 present 的题目是 Application of Plant Protein in a Patient with Chronic Kidney Disease and Sarcopenia, a Case Report in Clinical Nutrition。我们欢迎HENDRA先生，还是HENDRA女士啊？8分钟啊，8 minutes。你待会看一下，那有一个 time。OK， 好，谢谢。
大家好，我叫许湘华，我的导师是李建宁，我是河北医科大学 TIANYUAN 营养科的研究生。So today I'm going to present all of you about the application of plant protein in a patient with chronic kidney disease and sarcopenia, a case report in clinical nutrition. So the contents for today composed by all of these topics, and I'm going to bring all of you step by step through this topic. So let's start for the first part, which is introduction. So what is actually chronic kidney disease is? Chronic kidney disease characterized by its irreversibility and progression condition that has emerged as leading causes of death worldwide, as well as sarcopenia, characterized by progressive and skeletal muscle disorder and leading to adverse consequences such as physical disability and death. So plant-based food have a favorable impact on kidney disease. So why I say like that? Because have been often used as a model for low proteins diet and recently received increasing attention for its potential to prevent, to delay, and then to treat the progression of the chronic kidney disease. So this is some evidence that I'm going to show all of you, some study that has going on that show that plant-based protein has showed a good result, benefits while treating chronic kidney disease. It showed that there's a less dialysis in initiation and also the slow progression of chronic kidney disease. So let's go for the second part, which is patient history. So this is the general information of the patient. Male, 40 years old, he's from Hebei, Zhejiang, no allergy, and he has a habit which is unhealthy eating and abstinence from alcohol for 1 year. And he also has a past personal history, which is diabetes type 2 and then hypertension. So this is the patient history. So the patient was admitted at the hospital due to poor drainage of peritoneal dialysis catheter for 3 days at home, which is accompanied by alternating constipations, diarrhea, cough, and then lost appetite. So the patient has presented the past history like a diabetes type 2 and then hypertension. So this is the physical examination that we did from nutritional side. We did the nutritional screening and assessment. As you can see on the screen, the table that we did the height, the weight, BMI, and as you can see on the screen, that right triceps skin fold thickness and then left triceps skin fold thickness, the result was 7 millimeters. And then, other than that, sarcopenia was found during the nutritional screening and assessment. As you can see, based on the method of the sarcopenia, it showed that ASM 26.2 and SPBB is more than 12 seconds, and then grip strain 12 kg, and then BIA 8.1. So at the time was found as a sarcopenia during the screening assessment. So what is actually the diagnosis is from nutrition side? So the first one is the risk screening. As you can see on the screen, the NRS 2002 scored 4 points. And then the nutritional assessment, the SGA evaluation is grade C. So what is the nutritional diagnosis? So the patient actually at the nutritional risk. Second is severe malnutrition. The third one is a hypoproteinemia, and the lastly is anemia. So what is the treatment? What is the result that we offer for the patients? So we follow the national guideline of China based on the clinical nutrition to treat the chronic kidney disease and diabetes mellitus. So usually, how many protein that we have to offer for the CKD and diabetes type 2? So the proposed dissociation is 0.6 kilogram per day, and then should have a balanced protein structure. And the most important thing is we have to increase the proportion of plant protein. That one is the first one, is protein. The second one is the calories. How we can offer the calories for the patient with CKD and diabetes type 2. So the calories is 30 to 35 kilogram per day, and then low sugar food like fresh fruit, vegetable, whole grain cellulose. So this is the nutrition therapy. The patient received the enteral nutrition. We monitor the patient, the total protein, calorie, carbohydrate, and then fat. And then we did the comparison between the plain protein and then the animal protein. As you can see on the graphic, it showed that the day 1 and the day 7, we only offer the plain protein or animal protein for the patient. But the next day, we increase more proportion of the plain protein and less of the animal protein. And it showed good result. So this is the result of the patient. We monitor the result. As you can see on the screen, the total protein before the nutrition is 62.30, and after the nutrition is 68.40. Same as the pre-albumin, 79.20 before the intervention, but after the intervention is 141.30. And same as a hypersensitive C-reactive protein is 33.65 before the nutrition, and then after the nutrition it's increasing or it's less, it's 6.37%. The 6.37. So what is the comparison indicators between these two? So as you can see in the screen, we did a comparison. The NROs before is a 4, and then after the intervention is 2, SDA grade before is C, but after the intervention B, and then the grip strength for the left hand and the right hand is increasing. Before was 11, but now it's increased to 12.8 and 14.5. So what to say that one? What to conclude that one? It means that the patient nutritional risk reduction, decreased malnutrition levels, and the bimanual grip strength is enhancement. So we did the patient monitoring for the patient. So we usually intensively monitor the patient, and as you can see on the screen, here the most that I want to point it out here is the grip strength and the tricep skin fold for the patient. It's increasing as you can see on the screen. So let's go for the last part, which is conclusion for this part. So the conclusion is the result of this study demonstrated that the protective role of plain protein in kidney disease and sarcopenia. And the second one is to provide the new evidence for physicians and healthcare providers in the treatment and prevention of CKD by using plain protein. So lastly, I'm going to point it out this question, who are us? I'm going to bring all of you a little bit to know a little bit about our department, nutrition department. So this is our nutrition department. So our nutrition department was started prepared in 2007 and in 2006 and was established formally in 2017 May 18. So our lead is Lee Jian-nim. So the nutrition department has participated in the development of the guidelines policy and has achieved so many awards winning. As you can see in here, there's some achievement that we got from our department. Other than that, have personal achievement also that I achieved during my study, during my stay in Hebei, especially in hospital, in nutrition department, some achievement that I got during my study in there. So for that part, I'm going to close this presentation by today, and thank you very much for your attention.
大家有什么问题？时间控制得很好。评委和同学们都可以接受。
I have a question. Okay, so very good presentation. So you observe the protective effect of plant protein for the treatment of
for the chronic CKD.
Okay, CKD. So my question is that why you observe there are good protective effect of the CKD for the plant basis protein rather than the meat?
Yeah.
Okay.
Exactly. Thank you very much for the question. I appreciate your questions. So actually, it's incredible questions. People always know that CKD should be treated by animal protein, right? Because the CKD should need a lot of protein from animal protein. But in this case, this is a new attempt for us, for nutrition. We're using the plain protein for treating the patient with CKD. And it's actually show a really good result on it for the patient. And also not only that, it already saw a lot of evidence by researchers. They did the study, and even some study that they did, that plain protein actually have a really good I mean, like especially with patients associated with diabetes type 2 and then the hypertension, it is very good if we treat him with the plant-based protein. It doesn't mean that you didn't treat with the animal protein. You treat with the animal protein, but you less the animal protein, but you increase in most the plant protein. And actually, this is for our new department. This is a new attempt for treating the patient for the chronic kidney disease and diabetes type 2. Thank you very much.
I have a question. Thank you so much for presenting a very interesting case. But I have a question, like in the result you demonstrated that plant protein have a protective role to treat sarcopenia and the chronic kidney disease. But this is just a case report which cannot represent the results. So are you planning to perform any like big sample size study on this, or like any clinical trial or something? Because the single case report won't represent the actual process.
Yes, exactly. I totally agree with your question. So this is just a case report for the patient. So as I mentioned before, this is like a new attempt for us for using the CEAIE. Of course, if you want to know more about the plant protein, the benefit, you have to do more specific study for that one. So as I can say that I'm planning to it, of course I'm planning for it, for do more specific extensive study for it, because I know that actually there's a really good benefit while using the plant protein, because this one, not only this is the first time, because some study already showed that one, that the plant protein have a very good benefit on patient with the CEAIE. Thank you.
Next question. Thank you for sharing your result with us. I have a question like, I wonder how for how long time this patient, it's just one patient, as my colleague said, it's just one patient, one case, so we can't, reliably depend on we just look at his result. I wonder how long time this patient consume animal-based protein, animal-based diet, and then for how long time plant-based.
Okay, thank you very much for your question. I have shown on the screen, I don't know that you see detailedly, I already put that the week 1, week 2, and week 3. So the patient received enteral nutrition during the 3 weeks. I mean like 3 weeks in once. Actually, we know that the enteral nutrition program should be longer than 1 month. But in this case, the patient only admitted for 3 weeks and it already showed good result, even only a short period. But can you imagine that in the long period, the patient received the enteral nutrition? I'm sure that the screen that I showed to you, the result of the patient will be increasing, will be changed. But in this case of the patient, we only did the treatment for the short period, only for 3 weeks, because the patient, once he admitted in the hospital due to the alternating constipation, diarrhea, and lost appetite, and that time the nutritional should be intervened in that time. So in this case, we only give the 3 weeks nutritional therapy program for the patient.
So I'm sorry. For how long time is animal-based diet?
So for the I can show you here. As you can see on the screen, this is show the here. So the animal protein, as you can see in the blue one or purple one, that in the day 1 and day 7, the patients receive plant protein. After that, the next day, the day 8 until the day 23, we increase the proportion of the plant protein for the patient, and we we minimize or less the animal protein for the patient.
All right, thank you, Ms. Hendra. I'm sure many of you may have more questions. It's certainly a very exciting report. We have a coffee break during the middle of the session, so you can also ask me privately. So for the consideration of timing, I will just have to end the Hendra's presentation. Thank you.
Okay, sorry, I just wanted to say if you guys have any question, we can talk during the coffee break. Don't worry, feel free to ask me, okay? Thank you.
I'm not here to discourage you